The idea for the museum really goes back to 1970, but it wasn't until the late 80s, 1990, when the campus was put on the National Register of Historic Places, opportunities came to establish a museum here. And it was established as the Public Health Museum in Massachusetts as a place to keep the heritage of public health alive in an institution that was really steeped in public health itself, in terms of starting out as an almshouse and progressing over the years to provide services for people who otherwise couldn't get these services in any other place. One of the great efforts in human history is the conquest of polio. We're still not there yet because there's still polio in Africa and Southern Asia, but the polio exhibit here gives the story of polio from the early 20th century, when vast outbreaks occurred across the United States, through the 1950s, when the promise of vaccine first became available, and how people reacted to that. But at one time, thousands of people all over the world were living their lives in iron lungs. It was the only way they could survive the paralysis of polio. You know, public health goes back a long way in Massachusetts to colonial times. And we were one of the first places to have laws about sanitation, about nuisance. And really, you know, the public in general doesn't really understand what public health is. And I think a great motivation for this museum was to try to present the story of public health, both the historic record as well as what's going on now in public health, so that we could have a place that people could go to and learn about what public health is and what public health does. In the 19th century, you're pretty much just as likely to die in every decade of life as you were in any other decade of life. So, you know, we think now most people die when they're quite old. In those days, children died all the time, and young adults died, and women died in childbirth. It was a very difficult time. From the middle of the 19th century to the middle of the 20th century, it was really a triumph of public health in providing vaccinations, sanitation, better living conditions that prevented a lot of this early mortality. And I think now, as we look at how we live today, we don't really appreciate something like polio and the impact that it had. I think young parents say, well, why am I giving my kids polio vaccine? And they're not really looking at it in the context of polio still exists and it could come back and it could affect thousands of people. For example, if you just run the numbers in terms of population, in terms of the impact of vaccine, if we didn't have a vaccine and polio was still spreading like it was spreading in the early 1950s, we'd have 100 cases of paralytic polio a day in the United States. Every day, 100 people could potentially wind up in an iron lung, every single day. And I think when you look at it that way, you really appreciate, yes, we must do a good job of vaccinating people, because that, well, baby visits. There was a time into the 1940s when you had a baby, the community would know that, and a public health nurse would show up at your doorstep to make sure you understood everything you needed to do to protect that baby and to do the right things. And this was a tremendously appreciated service. You know, it was public health nurses in their blue coats would show up, and it was expected, and it was an expected service that the community was providing to you. I think a lot of these things fell by the wayside. It became a more complex society, a more mobile society, when parents worked, when they needed to provide care for the children in daycare. That model disappeared, but that was a model that was a direct interaction of public health with the public. The other thing I think it's important to learn from the history of public health, it's deeply rooted in human rights and in the abolition movement in Massachusetts, and in a variety of other social movements and social justice and social welfare. And I think that's what we try to convey here as well, to explain that to people, and so that they understand this role that people saw public health taking in the past.